You can run a 1OK. You can have perfect lab work. You can look lean, energetic, and unstoppable. And still, right now, a deadly blockage could be silently growing inside your chest. No warning, no pain, no shortness of breath. Just a ticking biological clock waiting for the wrong second. That's not fear-mongering, that's physiology. And for nearly half of men in America, the first sign of heart disease isn't discomfort. It's sudden death. How is that even possible? How can someone who feels amazing collapse without warning? The answer is simple and terrifying at the same time. Your body is unbelievably good at adapting. It will reroute blood, stretch arteries, and compensate for damage for decades. It will protect you from symptoms right up, until the exact moment it can't anymore. In this video, you're going to understand why strong hearts fail. You'll see how dangerous blockages stay hidden. And most importantly, you'll learn how to actually check your heart before it's too late. Because guessing you're healthy is not the same as knowing. To understand this silent threat, we have to look at the heart without the skin, ribs, and muscle covering it. Underneath is a powerful pump that never rests. Every minute of your life, it contracts and pushes blood to your brain, your organs, your muscles. It's one of the most oxygen-hungry tissues in your entire body. To feed that demand, the heart relies on its own private fuel lines called the coronary arteries. Early anatomists thought these vessels wrapped around the heart like a crown. That's where the word coronary comes from. But think of them differently. Imagine a massive tree. The heart is the trunk, the coronary arteries are the roots. If a root is cut, the branch it feeds dies quickly. There are two main coronary arteries, the right and the left. The left one splits into a powerful branch called the left anterior descending artery, often abbreviated as the LAID. In emergency rooms across America, it carries a chilling nickname, the Widowmaker. The name isn't dramatic for effect. It's geometry. The LAD supplies blood to the front wall of the left ventricle, the heart's main pumping chamber. That chamber is responsible for sending oxygenated blood to your entire body. If the LAD becomes suddenly blocked, the pump fails. And when the pump fails, everything stops. People assume a blockage builds slowly until it squeezes the artery closed like a clogged sink. That sounds logical. It sounds predictable. It sounds like something you'd feel happening. But biology doesn't operate on logic. It operates on adaptation. Inside every artery is a delicate lining called the endothelium. Think of it like a Teflon coating inside a brand new garden hose. Blood cells glide smoothly across it, no friction, no turbulence. In a perfect world, it would stay that way forever. But life isn't frictionless. High blood pressure acts like constant internal sandblasting. Elevated blood sugar from insulin resistance irritates the vessel walls. Smoking introduces toxins that inflame and damage the lining. Even decades of high-volume blood flow from intense endurance exercise can create microscopic stress injuries. These injuries are tiny, you won't feel them. You won't see them. But your body does, and it immediately goes into repair mode. LDL cholesterol particles move to the damaged site, trying to patch it like biological spackle. Then immune cells arrive to clean up the mess. Those immune cells swallow the cholesterol. Over time, they become swollen foam cells. Layer upon layer builds up. Calcium gets deposited. Cellular debris accumulates. What started as a repair process becomes a hardened mound embedded in the artery wall. This is plaque. This is atherosclerosis. Here's the misconception that gets people killed. Most imagine plaque growing inward, narrowing the artery until it chokes off blood flow. But in many cases, especially early on, the artery wall expands outward to accommodate the buildup. This is called positive remodeling. It means you can have a massive plaque deposit and still have a completely open channel for blood to flow through. Your stress test can look normal. You can run miles without chest pain. You can feel like the healthiest person in the room. Meanwhile, the wall of your artery is harboring a hidden blister. That's why the first symptom of heart disease in so many Americans is sudden cardiac arrest. No warning shot. No slow decline. Just a catastrophic event that feels instant. So what flips the switch? Why does a silent plaque suddenly become deadly? The answer isn't gradual narrowing. It's instability. Imagine that plaque as a soft, inflamed blister beneath a thin layer of tissue. As long as that thin cap remains intact, blood flows normally. But if you experience a sudden spike in blood pressure, extreme emotional stress, or intense physical exertion, that fragile cap can tear. This is called plaque rupture. When it happens, the contents of the plaque spill into the bloodstream. To your body, this looks like a serious injury. And your body responds the only way it knows how. It forms a clot. Clotting is life-saving when you cut your finger. But inside a coronary artery, it's lethal. Platelets rush in. Fibrin strands form. Within minutes, the clot can grow large enough to completely block the artery. The tragedy isn't decades of plaque buildup. It's the sudden cork in the bottle. Blood hits a wall. Oxygen stops. Heart muscle begins to die. This is a classic type 1 myocardial infarction, the kind most people think of when they hear heart attack. And it can happen in someone who felt perfectly fine that morning. But there's another scenario that doesn't involve a fully blocked artery. This one is common in high-performing, driven individuals who push their limits. It's a supply and demand mismatch. Imagine a disciplined 50-year-old runner. He trains regularly. His cholesterol isn't alarming. He feels strong. But inside one artery is a 50% narrowing. Not enough to cause symptoms at rest. Not enough to show obvious warning signs. Now imagine him sprinting up a hill during a race. His heart rate climbs to 170 beats per minute. The heart muscle suddenly demands a fire hose of oxygen-rich blood. But the partially narrowed artery can only deliver a garden hose. At rest, the supply was enough. Under stress, it isn't. The heart muscle begins to suffocate. This condition is called ischemia. If prolonged, heart cells start to die. When heart muscle cells die, they release a protein called troponin into the bloodstream. Think of it like the glowing liquid inside a glow stick. As long as the casing is intact, the liquid stays contained. Snap the casing, and it leaks out. Elevated troponin tells doctors heart cells have ruptured. This type of event is often labeled a type 2 myocardial infarction. The artery wasn't fully blocked. The system was overwhelmed. Demand exceeded supply. In many cases, additional factors make the situation worse. Electrical rhythm disturbances like atrial fibrillation can throw off the heart's coordinated squeeze. The top chambers quiver instead of contracting properly. The bottom chambers beat rapidly and inefficiently. Now combine a fast, chaotic rhythm with a partially narrowed artery. The heart doesn't fill properly. It doesn't receive enough oxygen, and it's working harder than ever. That combination can create the perfect storm. This brings us to an important number, 70%. In general, people don't feel classic chest pain until an artery is narrowed by roughly 70% or more. Below that threshold, the heart compensates. Above that threshold, you might notice tightness climbing stairs. Discomfort that fades with rest. That's called stable angina. It's your body's check engine light. But here is the dangerous twist. Many heart attacks originate from plaques that narrowed the artery less than 50%. Soft plaques are more likely to rupture than large, calcified, stable ones. The ones you don't feel are often the ones that break. So if you can't rely on symptoms, what can you rely on? That's where understanding your actual risk, not your perceived fitness, becomes critical. Because being in shape is powerful. But it does not make you immune, and biology does not negotiate. Here's the part most people don't know. Your heart is not helpless. It's not a fragile pump waiting to fail. It's adaptive, strategic, resourceful, and when blood flow is reduced slowly over years, it can build its own detours. This backup system is called collateral circulation. And it may be the difference between surviving a heart attack and not making it to the hospital. Think of your main coronary arteries like interstate highways. When traffic builds gradually over time, side roads begin to form. Smaller vessels enlarge. Tiny connections expand. The heart quietly builds alternative routes around partially blocked areas. If a blockage develops slowly over decades, these collateral vessels can partially compensate. They don't restore perfect flow, but they can buy time. And in cardiology, time is everything. This is one reason a 70-year-old with known heart disease sometimes survives a heart attack that would instantly kill a 40-year-old athlete. The older heart may have had years to develop detours. The younger heart with no warning buildup has none. When a sudden plaque rupture blocks a major artery in someone, without collateral circulation, blood flow stops abruptly. There's no alternate path, no side street, just a closed highway. In emergency medicine, there's a phrase repeated constantly. Time is muscle. That's not a slogan. It's literal biology. When blood flow stops to part of the heart, damage begins within minutes. Around 20 minutes without oxygen, heart muscle cells start to die permanently. After 60 to 90 minutes, large sections can become irreversibly scarred. Scar tissue does not contract, it does not pump, it does not recover. Once muscle is replaced by scar, that function is gone forever. That's why rapid recognition and treatment are critical. But here's the complication. Not all heart attacks look dramatic. Not all of them involve someone clutching their chest and collapsing. Especially in the United States, where millions live with undiagnosed coronary disease, symptoms can be subtle. Men often experience what's known as the classic presentation: heavy chest pressure, pain radiating down the left arm, sweating, shortness of breath, a sense of crushing weight. That's the Hollywood version. Women frequently experience something very different: overwhelming fatigue that feels out of proportion, shortness of breath without chest pain, nausea, upper back discomfort, even symptoms that mimic severe acid reflux. Because these symptoms are less dramatic, they're often dismissed. People wait. They assume it's stress, indigestion, exhaustion. And every minute that passes increases the amount of heart muscle lost. There's another symptom that patients often describe but struggle to explain: a sudden sense of impending doom. A feeling that something is very wrong. It's not anxiety. It's not panic. It's a deep, instinctive alarm from the body. Ignoring that signal can be fatal. Now let's talk about what happens when someone gets to the hospital in time. Modern cardiology has transformed survival rates in the United States over the last few decades. The most common emergency procedure is called percutaneous coronary intervention, or PCI. It sounds complex, but the concept is simple. Open the blocked artery fast. A cardiologist threads a thin tube through an artery in the wrist or groin and guides it up to the heart. Using contrast dye visible on imaging, they locate the blockage. Once they find it, a tiny balloon is inflated to compress the clot and plaque against the artery wall. Then a stent, a small metal mesh scaffold, is deployed to hold the artery open permanently. Within minutes, blood flow is restored, oxygen returns, and muscle that was on the brink of death can sometimes recover. But here's the truth. Emergency intervention is damage control. It's not prevention. It fixes the plumbing after the pipe bursts. The real goal is to identify risk before catastrophe strikes. And that's where screening becomes powerful. Standard blood tests measure cholesterol levels. They show how much LDL, HDL, and triglycerides are circulating. That information matters. But it only tells you what's in the bloodstream. It does not tell you what's embedded in your artery walls. It does not reveal whether plaque is quietly accumulating. For that, imaging is often more revealing. One widely used tool in the United States is the coronary artery calcium score, or CAC score. This is a quick CT scan that measures calcified plaque in the coronary arteries. It takes about 5 minutes. No needles, no exercise stress required. A score of 0 suggests no detectable calcified plaque. That's reassuring. A score above 100 indicates increasing plaque burden. A score above 400 signals high risk and significant coronary disease. The calcium score doesn't show soft plaque. It detects hardened deposits. But it provides a powerful snapshot of total plaque accumulation. It turns invisible risk into visible data. For even deeper insight, some physicians use a CT coronary angiogram. This imaging test can visualize both calcified and soft plaque. It shows narrowing. It reveals unstable areas that haven't yet hardened. Soft plaque is often more dangerous than calcified plaque because it's more prone to rupture. Identifying it early allows for aggressive prevention strategies. Now let's address something important. Exercise is not the enemy. In fact, regular aerobic training is one of the most protective interventions available. Zone 2 training, steady, moderate-intensity cardio, improves mitochondrial efficiency and vascular health. High-intensity interval training can stimulate vascular growth and improve endothelial function. Consistent movement encourages the development of collateral vessels. It improves blood pressure. It enhances insulin sensitivity. It lowers systemic inflammation. But exercise does not erase decades of accumulated damage from uncontrolled hypertension, poorly managed diabetes, smoking, or genetic predisposition. It reduces risk. It does not eliminate it. That's why prevention must be multi-layered. Control blood pressure to reduce mechanical stress on artery walls. Manage blood sugar to decrease inflammatory injury. Maintain healthy cholesterol levels to reduce plaque formation. Sleep matters. Chronic sleep deprivation increases sympathetic nervous system activity and elevates blood pressure. Stress management matters. Persistent stress drives hormonal cascades that contribute to vascular injury. Nutrition matters. Diets rich in whole foods, fiber, and healthy fats support metabolic health and reduce systemic inflammation. And perhaps most importantly, awareness matters. Assuming you're safe because you look fit is dangerous. Assuming you're doomed because of family history is equally misleading. Data beats assumption every time. In the United States, heart disease remains the leading cause of death. Not because we lack technology, not because we lack medication, but because silent disease often progresses undetected. The healthy heart attack is usually not a failure of strength. It's a failure of detection. Here's the uncomfortable truth. Most people in America do not die from lack of effort. They die from lack of information. They work hard. They exercise. They try to eat better. They assume their yearly physical is enough. And yet, coronary artery disease continues progressing quietly in the background. The solution is not panic. It's precision. If you want to protect your heart, you need to stop guessing and start measuring the right things. Because prevention is not about doing more. It's about doing what actually works. First, understand your baseline risk. Age, family history, blood pressure, cholesterol levels, smoking status, and blood sugar all contribute to overall cardiovascular risk. These factors don't guarantee disease, but they shape probability. High blood pressure is one of the most destructive forces inside your arteries. Every heartbeat under elevated pressure creates microscopic stress along the vessel wall. Over decades, that mechanical strain accelerates endothelial damage. Controlling blood pressure reduces that constant sandblasting effect. For many adults in the United States, this means lifestyle changes, medication, or both. The goal is consistent control, not occasional improvement. Blood sugar is another critical factor. Insulin resistance and poorly controlled diabetes increase inflammation and glycation inside vessels. That inflammation makes plaque more unstable and more likely to rupture. Maintaining metabolic health is not just about weight, it's about insulin sensitivity. Regular movement, resistance training, adequate sleep, and minimizing ultra-processed foods all improve glucose control. Next comes cholesterol. LDL cholesterol plays a role in plaque formation, especially when the vessel wall is already injured. Lowering LDL reduces the raw material available for plaque buildup. For some individuals, lifestyle changes are enough. For others, medications like statins significantly reduce risk. The decision should be based on measurable risk, not fear or stigma. Now let's move beyond blood tests. If you are over 40, especially with risk factors or family history, a coronary artery calcium score can be a powerful tool. A CAC scan quantifies calcified plaque. It transforms abstract risk into a visible number. 0 suggests very low short-term risk. Higher numbers indicate increasing plaque burden. This test does not replace healthy habits, it informs them. If your score is elevated, you and your physician can respond aggressively with medication, diet, exercise, and close monitoring. For those with concerning symptoms or higher calculated risk, a CT coronary angiogram may be appropriate. This imaging shows both narrowing and soft plaque. It provides a detailed roadmap of your coronary arteries. Seeing plaque directly can be life-changing. It shifts prevention from theoretical to personal. It motivates sustained action. But screening is only valuable if followed by action. If plaque is present, the strategy is stabilization. The goal is not just to reduce size. It's to harden and stabilize plaques so they are less likely to rupture. Lowering LDL cholesterol reduces lipid content inside plaques. Controlling blood pressure decreases mechanical stress on the fibrous cap. Managing inflammation reduces vulnerability to rupture. Exercise strengthens the entire cardiovascular system. Zone 2 training improves mitochondrial efficiency and vascular elasticity. Resistance training preserves muscle mass and metabolic health. High-intensity intervals, when appropriate and medically cleared, can improve cardiac output and stimulate beneficial vascular adaptations. However, extreme overtraining without recovery may increase stress hormones and inflammatory markers. Balance matters. Consistency beats intensity. Sleep is often underestimated. Less than 6 hours per night is associated with increased cardiovascular risk. Deep sleep supports hormonal regulation, blood pressure control, and metabolic recovery. Stress management is equally important. Chronic psychological stress activates the sympathetic nervous system. Persistent elevation of stress hormones contributes to hypertension and vascular dysfunction. Techniques like breathwork, meditation, time in nature, and meaningful social connection are not luxuries. They are cardiovascular interventions. Now let's address something critical. Not everyone with plaque will have a heart attack. And not everyone with a heart attack had extreme plaque burden. What determines outcome is often plaque stability and timing. A small unstable plaque can rupture suddenly. A large stable plaque may never cause an event. That's why prevention is about reducing instability. It's about transforming vulnerable plaque into quiet, stable tissue. If you ever experience warning symptoms, act immediately. Chest pressure lasting more than a few minutes. Shortness of breath at rest. Sudden nausea with weakness. Unexplained severe fatigue. Do not wait to see if it passes. Do not drive yourself if symptoms are severe. Emergency response time directly impacts survival and muscle preservation. Remember, 20 minutes can begin irreversible damage. 90 minutes can permanently scar large sections of heart muscle. And if you survive a heart attack, life changes. Scar tissue does not contract like healthy muscle. Pumping efficiency may decrease. Medications become lifelong. Activity tolerance may shift. Prevention preserves not just life but quality of life. The phrase healthy heart attack is misleading. It implies randomness. In reality, most events develop silently over years. They are the final chapter of a long biological process. The tragedy is not that the body failed. It's that the warning signs were invisible without proper testing. You would never drive a car for decades without checking the engine. You would never ignore dashboard alerts. Yet many people ignore the most important pump in their body until it stalls. Modern cardiology gives us tools, imaging, blood markers, risk calculators, medications, training protocols. The missing link is awareness and action. Do not assume your fitness protects you completely. Do not assume family history seals your fate. Measure, interpret, adjust, repeat. Heart disease remains the leading cause of death in the United States. But it is also one of the most preventable. When you control blood pressure, optimize cholesterol, manage blood sugar, train intelligently, sleep adequately, and monitor real data, you dramatically shift the odds in your favor. Your heart is resilient. It can adapt. It can build detours. It can recover when given support. But it cannot survive a total blockage without blood flow. The difference between catastrophe and protection often comes down to one decision: choosing to know instead of assuming, because biology does not care how fast you run. It does not care how strong you look. It responds to physics, chemistry, and time. And when you respect those forces, you give yourself the greatest advantage possible. This video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your physician or qualified healthcare provider regarding any questions about your heart health or medical conditions. Never ignore professional medical advice or delay seeking emergency care because of something you watched here. If you believe you are experiencing a medical emergency, call 911 immediately.